Good morning, Trinidad and Tobago. It is Friday, the 3rd of April. My name is Felicia Holder, and I am your host of Pep Talks in the Morning. This morning, I am welcoming two brand new co hosts with me today, Kenneth Luke, head of our advisory council. Kenneth, good morning.
Morning, morning.
And to his right, well, what you would see as your right on the screen, Sarana Ramlochan, who is part of our PEP UK chapter. Sarana, good morning.
Good morning, Felicia, Kenneth, and good afternoon or night to anyone else in any other time zones.
Right, so let's kick this off. Yesterday we had Anthony Sinanan, who is the head of our PEP Toronto chapter, all the way from Canada, who would have brought us some insight into what is transpiring with regards to the COVID-19 virus in Canada. We did a nice little deep dive into government response, the responses of the people, the public themselves. We spoke about in length about initiatives, grants, and measures being used to mitigate and support the people who are being impacted by this COVID-19 pandemic, which is basically impacting a big percentage of the globe today. This morning, very fortunately, we have Kenneth and Sarana joining us, giving us a United States as well as UK perspective. What you should know is that these are two core members of the Progressive Empowerment Party, and I'm really happy to have them on this morning, giving us some insight into areas that we may be only aware of via social media or via news streams. But we have two people live in person here bringing you some information on the COVID-19 response in the United States and the United Kingdom. And we are going to touch on that as it relates to what we're doing here in Trinidad and Tobago. It's never supposed to be a comparison of who has it better or who has it worse, but the purpose of government is always the well-being of the citizens. And my aim is for the citizens of Trinidad and Tobago to understand how much better they deserve and to get an insight, a real unbiased insight about what is happening elsewhere, what is happening globally. So you can use that sort of as a measuring stick to see where you are and where we may be falling short as a country. So Kenneth, good morning again to you. We are talking the COVID-19 pandemic, and I don't know if you'd like to tell me in your own words, how is it unfolding?
Morning, Trinidad and Tobago. U.S.-based situation is how it's happening here is that right now, as most people know, there are more than 1 million deaths internationally. The U.S. is basically, more than 1 million cases internationally. But the U.S. has basically climbed to a quarter of those cases. And what we see is rates of testing are turning up more cases. So as the testing gets better, more cases are being made public, and people are dealing with the deaths, because in the US there's approximately 6,000 deaths as of this morning. So what's happening is that we are responding to it emotionally first. We look into the fear factor is basically a big part of what's happening, and the impact is touching everybody because of the stay-at-home advice from the medical professionals on the pandemic team. So you have a lot of people who are allowed to work from home. Those who can are able to. Those who cannot, basically some people are being, what you would say, they're being furloughed or terminated. So today, as of this morning, I think the figure climbed again to 254, with 6,059 deaths occurring. The hospitals are having a difficult time because they're overloaded. Some people are working My son is one of these emergency medical nurses, and he's worked like 10 shifts straight since the beginning of last week. So, it's impacting families. And then the rate of infection, you try to stay away from socially distance yourself so that people are not can't infect you and you can't infect anybody else. That's it.
Okay, I'm doing this a little back to front. I was actually supposed to ask you to do this before, but if you can just introduce yourself to the public, just letting them know who you are and what you do in the Progressive Empowerment Party.
Yeah, I'm a member now since the party started 3 years ago. Um, I've been involved in the policy development, the constitution, and the policies, programs, and the manifesto. And we have a team that works. It's a local and international team that have been developing all the policies, especially the key ones that we focus on: jobs, healthcare, homes, the national security issues. And what we have found in doing this work is that it's all interrelated. It's like a weaving a fabric where things are horizontally and vertically integrated, and what we have is now a total landscape that matches policy to the nation. So that's what I've been doing for 3 years in the PEP. And I'm not local. I'm definitely not local, so we have that challenge as well.
Yes. So, Rana, good morning again to you, my dear. And again, thank you so much for agreeing to be part of this program. I know I only have you for 45 minutes, so I'm going to squeeze every last drop of information out of you that I can get in that time. Please introduce yourself to the viewers. Tell us a little bit about what you do and your role as part of the PEP UK chapter. I know we're really just about to start that up, but I know you're very interested and active on the PEP operations group and getting the PEP UK chapter to where the rest of the other chapters like Toronto, USA, New York, and Florida are. So tell us a little bit about yourself.
Thanks so much, Felicia. And Kenneth, thanks a lot for warming up the platform. I think we have a lot of similarities, despite we're working in different countries at the moment. So I've been in the UK just shy of 16 years, still have a vested interest in Trinidad and Tobago's welfare and health. And, my intention was always to come back home. But, knowing the state of the country, the economy right now, I am proud to be part of the PEP membership, and I've just been a member just under 6 months now, but working closely with the local teams in Trinidad and any other chapters that are globally constructed as well. On the forefront of that agenda is, to create a healthy and happy and sustainable community that we can not only survive the current challenges, but being able to thrive in the 21st century and onwards. So just as Kenneth, explained exactly what is happening in his particular expertise, similarly, I'm working in the IT industry. I started off in the financial sector in Trinidad, mainly private sector. And when I moved to the UK, a lot of my projects are focused in the public realm. What my current experience is mainly focused on business change and maximizing productivity. So we are in the fourth industrial revolution. It is about the information knowledge and digital technologies. So my focus is, delivering seamless services that we can optimize resources, and it is about transforming the human capital. It's not just delivering IT technologies or change. What that means really, and quite similar to what we're seeing today, is the impact change will have on people, whether or not it's legislative changes, whether or not if something is not functioning right, whether it's external factors like, financial crisis that we saw in 2008, economic changes, environmental changes, climate changes that we're seeing currently and possibly in the background right now because of the current pandemic, sociological changes. What we tend to do in our industry is, focus on how we can transform and take people on that journey, as well as address the emotions. On a personal note, as well as professional note, we're all impacted by different emotions currently. We're experiencing anger because of the situation itself, moving from liberty to lockdown. We're all at different stages in the current pandemic, but also too, it's how our leaders are making decisions on a daily basis that's impacting us. And in the recent days as well too, some of the deaths it's hit close to home. Some of my colleagues, their parents as well too, have recently passed away. So it's trying to be resilient at the same time, because you're trying to formulate and stay strong in a community, but the community factor is the very thing that the coronavirus is preying on. So fortunately, we have digital technologies that we can stay connected and, keep supporting each other through this.
Indeed, and I did not, this was quite accidental that I brought two very brilliant minds, both in the field of IT and change management, on with me this morning. But I think this coincidence was perhaps the best coincidence that we can ever have on a pep talk show. Sarana, so tell me a little bit more about the COVID-19 experience, your personal experience, as well as what is happening in the wider, in London and in the UK at this moment.
Sure. I probably shouldn't be saying this, but I think over the last 6 years, especially moving from a small country like Trinidad, and as well to being exposed to the UK, the population is over 66 million, and I've become OCD on hygiene. So always have my hand sanitizer, carry my wipes anywhere. I'm traveling, airplane, trains, and so on, I would wipe it down. But what you tend to do is you start observing the external environments around you. And I think just like everyone else, when the pandemic started as an epidemic in China, we heard about it, but sometimes it's easy to turn off news and go back to your daily life. And so the emphasis or the significance or seriousness was possibly ignored at that time, and with the advice from the World Health Organization. By the end of January, there were 2 cases that cropped up in York, which is North England. By the end of February, there were just under 20 cases. Now, even in that particular month, in the space of a month, I started to get very paranoid on a personal level. To my family, you saw what was going to happen. And perhaps, maybe the exercise or the proactive actions or precautions that could have been taken came late. But on a personal note, I did travel. I had to go to 2 of the Scandinavian countries, Finland, which is really Nordic, as well as Norway. Now, their hygiene standards are highly rated. When you go to those public places, they have hand sanitizers, and it's a different standard to the UK. It is a period of seasonal flu as well. Traveling on trains or commuting as well, you have at least over 1 million in London who daily commute as well. So it was inevitable that it was going to happen with late action. How it has affected the wider community. Today we have 33,000 cases, and that's just tested. The government and the media has admitted, because there's low capacity in the national health sector and services that were hit by Brexit scenario and austerity measures in the last decade, we are under capacity. They are under resourced, and they're doing everything they can right now to upscale resources through cross-training, as well as upscale and upgrade that sector. The Chancellor and the current Parliament, they're fast-tracking legislation as well too, where local authorities are taking unprecedented measures as well to make sure to reduce contact. So we've gone from avoiding restaurants and bars by the 12th of March to proper lockdown on the 23rd of March. The Corona Act bill passed on 26th of March as well too, and gradually you've seen the essential services adapting social distancing, which is great because it gives you that reassurance it is being followed, but we gradually got there. I think the main concern right now is priority for testing frontline services and testing people just generally. So there's, as Kenneth explained, that fear, there's fear on what you see on news, what you might see on Facebook, what is coming out of news, and especially in the UK, the nearby European countries, even though Brexit is still very much on the agenda as well too, but still there's a closeness, we're tightly interconnected, and we are of course on the European continent. So you're always mindful of what is happening in the nearby countries as well. Generally, people are very emotional. Even my colleagues as well. a very emotional meaning. Like sometimes you express anger, you express frustration, not having the option to go out anymore. But we generally remind each other that there is an underlying reason for that, to keep safe, and there's a greater purpose as well. What has helped quite a lot is introducing Clap for Carers campaign in the last 2 weeks. And I believe it has been announced to be done in Trinidad. And it's every Thursday night, but what it does, it's that moment of solidarity where we all stand together, and it's not just restricted to the UK, it's worldwide. We're in this together, so it's quite uplifting, and it is an overwhelming sense of emotion, but that keeps us going.
Thanks for that, Sarana. And you mentioned that, I know you sent me an article that mentioned that the UK is seeking to expand or increase their testing to about 100,000 per day. Because as of right now, there's a a shortage of testing kits available in the UK. And I know you have as compared to Trinidad, you have over 33,000 cases of the virus right now.
Yes, yes, you're right in that because of the under resource and so on. To what on a personal note, we have heard about cases, my friends, colleagues, and so on, to have sometimes in mild strains of symptoms. Some have had it more than others, and so there's still a perception that it's just targeting the elderly and so on. That is not necessarily the case. Some of the age groups, that I know, it's under 40, and they've been hit really hard. For instance, one of my colleagues, he's quite a strapping young lad. He's the type who will wear shorts, t-shirts, and so on, things like that in winter season. And the amount of chest pains that he's experienced, he said he does not know how the elderly can cope with it. Not needless that everyone else will go through the same experience. But really, in context, these are colleagues, at least 3 out of every 10 that I know, who has been hit by symptoms. Some are not sure, some more stronger than others, but they weren't able to get tested. Some are still suffering from respiratory problems. They do have asthma, but some don't. And it's difficult to say. Even you might have not had an underlying health condition 10 years ago. It might have cropped up a year and it's undetected as well. It is an ambitious goal to reach 100,000, and this was their intention, to ramp up testing to 20,000 a day over the last couple of weeks. Getting the kits right now is very difficult, and so some of the extreme measures they will have to take is getting the private sector involved and looking at creating diagnostic kits. Other countries like South Korea and Singapore in January and early February, there were more resources available then, but now globally, because we are all at different stages and the cases are heightened because some of the lockdown measures have come late, then we're really outstripped for supply in those areas. I think in Italy, and one of the hardest affected areas is one of the places that they were producing the testing kits. So that is no longer available and can't be supplied there. So we have to find other measures to be put in place where it can be locally created and supplied.
Mm-hmm.
Understood. Lockdown measures, Kenneth and Sarana. Right now in Trinidad and Tobago, we discussed this on the program this week, that we're not certain that the lockdown measures, because we have not officially declared a state of emergency. However, we do and are asking the public to stay home, practice social distancing when you do have to go out, quarantine yourselves if you know you may have been in contact or traveled recently or something along those lines. However, we still have restaurants. All of our KFC restaurants are open. We have other restaurants, Pizza Boys, Royal Castle. People are going to the grocery and lining up. People are going to the banks and lining up outside. And I want to know, what is the lockdown looking like right now in the UK? Is this a case where you have the UK and the USA? Is this a case where we have some establishments having to close? Because in Trinidad, as much as we have the restaurants open, you can't dine inside the restaurants, but the bars themselves, bars are completely closed because bars are known as a lineman and congregation area. Is it that all of the food and bars have been closed in the United States and the UK, or do we have a case where some are allowed to be open based on certain measures that they have to implement?
You want me to go?
Sure,
Yeah,
go
can
ahead.
I do that?
What we have here is the practice of social distancing New Age says 6 feet, and it's based on the droplet size and the sputum from people. They are now advising the wearing of masks. If you don't have a mask, they're asking folks to preserve the masks or the mask usage for the healthcare professionals. But the idea of having to go outside, there is no order that you must stay indoors. Just that people keep practicing self-protection and by extension protecting others. So bars, I have not seen a bar open since they recommended this. Prior to the recommendation, there were a lot of associations and parties still going on. Kids were all over the place, spring break and what have you. But with what's happening now, because they believe that it is rising to the peak, it's in that part of the curve, the infections and the deaths. What's happening now is they're basically saying, look, we really want you to stay inside. In some states, I notice people are getting tickets for being outside. On the only real thing they're asking you to do is to make sure that you protect yourself and protect others by wearing a mask, gloves, and so on. If you have to go to the grocery and the pharmacy, the groceries have adopted, just like Trinidad has adopted, a thing of cleaning the shopping carts and making sure people are coming through. The doors have adequate clean stuff to push around and so on. And essentially, we here at my home are locked down. We only have one family member that goes out because their job is an essential job. The rest of us are working. I'm working from home because my job says that I can work remotely. I have the type of job that can work remotely. Others are not so lucky. What's happening is they have been either furloughed or terminated. And the government has moved slowly, but they are now getting things into place to make sure that people are being supported with stimulus funds. They passed a $2 trillion package, and the package gives some support, but for the persons, for the people, individuals, they have a one-time check. And I have the data on that. We could talk about that later. But the idea is that's taking a while. It's just come into play. I think they will get up on it fast with the electronic funds transfer type of stimulus money. But on the people who receive paper checks, they're talking about September. By the time those checks are cut and go out, we have 6.6 million people that applied for unemployment insurance in 1 week. And so at this point,
Wow.
people are just trying to keep off of the street. Go ahead, Felicia.
Understood. Sarana, and lockdown in the UK, what is that like right now?
It's very similar to what Kenneth is describing, and because of the Corona Act that was implemented on the 26th of March, but announced on the 23rd, you do see the social distancing a bit more. In respect to your question about like restaurants and essential businesses, we don't have KFC open. I am quite surprised that has been allowed to continue. What we've seen is like supermarkets and so on having to readjust. And over a period of a week, I would say between the 20th and the 26th, when I had visited supermarkets, you'd see that now they have more protective wear and protective gear on. They have plexiglass as well to separate, as well as some of these spots are marked 6 feet apart and one in, one out of the supermarkets. Because we do have a lot of online-based systems, takeaway was massive with certain takeaway services like Deliveroo, Uber Eats, and also Just Eats as well. Because we're aware that we are helping the local community, that has been allowed to continue. Only takeaway services. Pubs and restaurants are closed, they're shut. But what you can do is you pay everything online, right? And you're aware that takeaway services, they're rated by their hygiene as well too. They know what they have to comply with at this point, and what they will do is they can drop the food on your by your front door, send a message, and you pick it up as well. You're aware, same thing, the supermarkets as well too. Now they're cleaning their trolleys as well. So I didn't think my OCD could get any worse, but it has. There's always a possibility. So you've seen those changes gradually, but now everyone is adopting it and you're getting used to it, which is really reassuring as well. What we do have as well, we have a postcode tracker for cases, right? Now, and this is not something, I know the information is not allowed in Trinidad. I disagree that that information is not useful, and I'll tell you why. On a personal note, we're still allowed to go out for one form of exercise. I believe they can track your data if you've exceeded that one trip, but it hasn't been too enforced in that way yet. I can look at this
Wait,
postcode. I can
sorry,
see
how are they tracking this?
your data through location, because the phone companies
So,
are
so your
working with the
cell phone.
government. Yeah,
Oh,
through your
wow,
cell phone.
okay.
Yeah. So and they can, they'll be able to tell if you go out more than once. You can travel to work if you are a key worker and support an essential frontline services, but you need to carry a permissive letter. On the postcode trackers, because you're allowed your one form of exercise, the weather is actually, the temperatures are increasing. We've hit spring now. You do get a little bit frustrated and you get that cabin fever at home. But you would make that informed decision if you see the cases rising, whether or not you decide to just stay at home, bear it out, stretch your legs, or you can take in one form of exercise. Similarly, if you want to stay in your local area for basic essential shopping, things you cannot get online, the online services, they're inundated with requests. So some of the convenience you might have had before, you have to wait longer now. But also to local businesses. Remember, if you're seeing cases are ramping up, you have different like off license that sell same things like the grocery, just on a lower scale, and they sell the alcohol and so on too. But if they're seeing the cases increasing, they can still make a financial decision whether or not they want to open that week or the week after. So we don't have the personal information of people available on that tracker, but we have the number of cases. And we know it's severely underreported because of the undetected cases. Some people, I think, in finding solace that their loved one has died and they weren't able to spend the last days with them, they are going publicly with the names and the ages and so on as well. And I think it's just because they're pulling the community to grieve with them. So it's still up to the individual if that's what they would like to share. On that note, I don't agree, with some of the decisions not being able to release those figures by geographical location. You don't have to publish. If you want to resort and say the public, well, there'll be violence and so on, no, well, then take them through that. Take them and say why we're publishing it and pull together as a community, because no one went out there to get the virus. No one made that conscious decision. In fact, some places in Italy have admitted it is the middle class who were mostly diagnosed with cases in some provinces because they travel more. But they didn't go looking for the virus. They didn't ask for it. And remember, we are all learning about this together. The medical industry as well. Some signs, some symptoms, the travel, the rate of spread as well, the different strains that have been mutated. So, let's try to change that behavior towards it as well, and not bash each other, but we're in on this together.
So I got to say
Exactly.
something.
And go ahead, Kenneth.
No, what I'm saying is here there is no enforced restriction. In certain states, they're giving tickets for people found outside. For tracking, they are now beginning to track those who have been released from medical care with a thing they use on the wrist. So they don't really intrude on people's freedom from the standpoint of enforcing this like a state of emergency or something. And I think they will keep not trying to enforce it to the degree that you infringe on people's freedoms. So that's
And that's
really
actually a point that I want to get into, as Sarana mentioned, the tracker.
because
And
it is going against the freedoms here that people will revolt against actually, and in some cases maybe violently. People resist it. They do what they have to do anyhow. Some groups of people, but mainly the mainstream is staying indoors and keeping the protections in place. Yep.
Yeah. I mean, it's not an understatement to say, well, it's an understatement to say, sorry, that technology and this COVID virus has actually forced Trinidad and Tobago to move, and I would say leap years ahead of where we were. We have business places now that are offering delivery that would never deliver before. I know where I live, there are still areas that cannot receive or did not receive delivery before the COVID 19 experience. Now they are basically offering delivery to almost any and every point in Trinidad and Tobago. And I mean, they say that crises often present the opportunity for change. And I would say that is one of the positive changes that we have seen here in Trinidad and Tobago, that businesses are using e-commerce, they're using online, they're using those mobile those mobile, gosh, I forget what you call it, when you can, the delivery man comes and you can actually pay with your links or your credit card, as opposed to some areas where you could only have used cash. So, I mean, that's very positive for us here in Trinidad and Tobago. But there was an article that I read, I read a piece from Kenneth, I tagged you in it yesterday, an article from the UK Guardian written by Peter C. Bacon. Tirana, a lot of what you discussed this morning, it fell right in that avenue. And I want to tag you on that post. I think you should definitely read it. It does speak a lot about the civil liberties and the rights that we as citizens are going to lose amidst this COVID-19 pandemic. When we had the 9/11 crisis back in 2011, we saw governments implementing stricter measures to monitor citizens, monitor their movements, monitor their data. And it's also something that we're seeing happening in and during the COVID-19 pandemic as it unfolds. We're seeing, like you mentioned, and I read about it, that the UK, they're using systems to track their citizens. And I mean, as of right now, it's something that is positive. It's something that is going to assist with the pandemic and monitoring and controlling the situation. However, some people are worried and concerned that after the pandemic, that these rules and basically legislation that has been put forward to monitor citizens, that it's going to continue. And is that something that you see or consider a concern post in a pandemic, that these measures that have been put in place now may continue and infringe on the rights of citizens?
If people believe that they're not being tracked before COVID, they're severely mistaken. Because
Indeed.
you carry around a GPS locator in the phone. This thing here. So they have been doing the tracking though, based on the releases, and because they're looking at contact, the contact mapping, so that if somebody in the network of contacts turns up, they know where it came from. And they've been experimenting with certain drugs that seem to be showing positive signs. Antibodies being developed from patients who have come out of this thing successfully. They've been drawing the blood to make serums to try to make an inoculation or vaccine. So there's work on that side too. But I want to say something about response. And I don't want to compare it to Trinidad, just to give an idea of how the response has been here. In effect, the initial response was slower and they recognized it too late than the rate of the contagion. So it was overcoming them. And the ramp occurred somewhere in mid to early February. And it climbed severely with the amount of cases, because the cases were being discovered We believe, however, there's a school of thought here that many people had this virus long before it really became rampant. So the initial response being too slow, where a comprehensive plan of resources, available testing processes, and emergency and ICU protocols, they didn't yield the swiftest recognition. There was an initial belief of the fact that a potential pandemic was afoot, and in the case of a publication that is now circling the internet, that showed that there was knowledge of it long before, but nothing was done. The stockpiles were depleted at that point because of SARS and other things that there's a system here called the National Emergency Disease Surveillance System, and it arises out of the Department of Human Services, the Center for Medicaid and Medicare, CMS, basically maintains science that tracked these pandemics. And that study was an indicator in 2019, but then the study has gone into a do not distribute filing system. The CIA is now recognizing that there have been incorrect or untruths being told about quantities in certain areas, specifically China, because that's nationally known. So the response is now catching up, and we get into the point where we get in the supplies. People are keeping themselves socially distanced as much as they are doing. Some not so well, some not at all. But I believe they're beginning to see some traction on all that has happened slowly, but it's coming up to speed. So I think that what we are seeing here is some sort of indication that success is on the horizon.
Okay, Sarana, I don't know if did you get the opportunity to answer that question on the eradication of civil liberties? No, I don't think you did.
No,
Anything to add on
no, but
that?
sure, I'll probably
Sorry.
answer that in twofold. Exactly what Kenneth has said in terms of the surveillance of citizens' data as well. With the rate of spread with the information knowledge and the digital era as well too, regulations are now in place in some countries for data processing. In 2016, the UK, they introduced, well, actually the EU introduced the GDPR, which is the General Data Protection Regulation, and it is based on 7 principles, which is lawful data processing, as well as the storage of information, need not be more than it's reasonably needed for, really, and also like the alteration and the use of data while we're collecting the data, that's on a personal level. And so we do have that right here. We can make information requests, and also too we can ask for our data to be deleted if there's no longer use in that particular organization. Within the public realm, and particularly within my organization right now, there are different service areas where we need the personal data. And what we've had, especially to assist the government to roll out their initiatives for the vulnerable as well, those who may have mental health and would need extra support as well at this time. So there is a duty of care to people, and we're going on the assumption that what we need it for is for lawful processing and to deliver that service to support them at this time. Now, we have to comply with GDPR principles. Some of our changes in technology on the technological forefront as well too still has to go through that GDPR principle. And but that's in the UK anyway. And on that right, it may be that something that Trinidadians can look at, or if something that PP would like to impose, and fight for, really, because really the destruction of that data should happen when it's no longer useful, so it's not abused. On the rights for freedom, I would say yes. People are generally saying that the autocratic or the draconian measures being taken now infringes on their rights, and there might be conflict in legislation. but you are seeing why it's necessary. Because as Kenneth saying, you saw a lot of activities up until last week. Trains were rammed in the UK cities as well, and they've had to enforce those measures. They can probably go too far, but then that will have to be reviewed as we go along, and it may not be in real time. It is going to be difficult, and there will be challenges from the public as well, but it's deemed necessary right now because we know the cases are higher, and we are expecting a surge, and we're planning for a surge in the UK right now. So it's only for the safety
And
of
so,
the citizens.
Rana, just for the benefit of the viewers, can you explain what GDPR means?
Sure. GDPR is General Data Protection Act, and this was introduced by the European Union. It addresses the transfer of personal data outside the EU and EA, and it really is to protect the personal data privacy of that particular citizen. So it's built on 7 principles: the lawful processing of personal data, which includes collection, organizing, structure and storage, alteration, the communication, combination, as well as the destruction of personal data. So you cannot get your data sold to another third party. You can actually impose and probably take legal action against the unlawful use of data here. And most organizations, all organizations had to comply. We were given 2 years to get ready for GDPR because the fines going to be imposed. And we've seen the abuse from, Facebook companies as well too. Different kind of political strategy or propaganda, things like that in campaigning. So it can be unlawfully used. And I think it is up to citizens, if it's not imposed by current government legislations as well too in your respective countries, there's no way that we can't start campaigning for those. It is your right.
It is. And Saran, I know I only have you for a couple more minutes, and that's so unfortunate, but I do want to get some insight, if you could, before you go. Kenneth mentioned about 6 million people would have applied for unemployment benefits in the United States in 1 week only. Can you tell me a little bit about what is happening as it pertains to people who may have been retrenched, may have been declared redundant, may have been had their employment put on hold for a couple? Are there any grants and initiatives available and being administered by the government to the public?
Sure. I'm happy to share a link if in case I can't really articulate everything that has been promised at the moment. So the Chancellor, as of 2 weeks ago, and it is changing, their temporary targeted measures to help public services, and especially where you can support job retention schemes and different grants, those who are self-employed, those who have small businesses as well, being able to defer or get payment holidays on your mortgages, which includes like mortgage companies coming to get on those schemes as well, and grant funding. There's a bit more to it, so I can send through the details for you to share. But what is happening, especially we've seen worldwide and even in some developed countries as well, it is exposing a lot of weak systems, weak leadership, right? And what might happen is that some of the initiatives being proposed as well in implementing those projects is not happening quick enough in mobilizing the resources. And so there might be some loopholes or gaps, and we do have an upsurge in terms of the benefit application as well, where some businesses are not able to cope with processing as fast as possible, or maybe what has been promised as well to their loopholes and it's being challenged. However, I have to say that the communication is a little bit more clear and concise now. For NHS especially, where those in frontline, it's soon been disclosed that they don't have enough personal protection gear as well. As of yesterday, the health secretary did announce that they were going to write off 13.4 billion, I believe, in debt for the NHS. So that is a huge relief. There's a lot more commitment. They are saying within the UK, we're going to do everything it takes. And sometimes there's a bit of skepticism on that part, especially looking at what has happened with Brexit as well. So you go with a little bit more critical thinking there. You do have to assume, and we're looking at optimistic ways of some of the decisions being made, that hopefully this change will take effect and make people reflect, even our leaders in political position, and do the right thing for citizens as well. You can only be optimistic and learn from it, but we'll have to see how this goes. I guess in terms of the application processing, very similar to what is happening to the state. The systems are burdened and they're going as fast as they can, but even in some of these government departments, people are falling ill and also there's some single point of failures that we have to look for workarounds and measures on a daily basis. In all the meetings that I've been, they are doing everything they can to cross-train as fast as possible and deploy resources, to make systems a bit more robust. Similar to what you said on the innovation forefront in Trinidad, if it's a time that you didn't think, the best ideas could come, and we're seeing the opportunities, it is happening now. And hopefully, that's a positive that we can actually sustain going forward.
Hopefully. Sarana, I know we are out of time with you. Thank you so much for joining us. Do you have any closing comments before you have to depart and leave Ken and I?
Sure. Thank you. It was an absolute privilege. I will send you any information you deem necessary to share with everyone as well. What I would say is that even though we're in different zones, we're in different stages of the pandemic, there's still that sense of togetherness. Even more so when this had happened immediately, I called my family in Trinidad, in the States as well. It is even more concerning when you know that the healthcare system is more compromised than a more developed country as well. It's definitely cause for concern. The vulnerable, those who suffer and who are on the breadline before as well. What I would say, it is difficult. It is an incredibly difficult thing to deal with, on a personal level, on a professional level. When you see the news, your heart probably sinks every bit more with, devastating news. We're in it together, and we can do this. You just remember you're part of a wider reason as to the future generation to come as well and to defeat it. What I would say, utilize your tools, utilize technology. For those who are unfortunate, maybe find ways that you can group digitally that you can help the most unfortunate, whether that be toys, books, or so. But just remember, if you're more privileged, do your best to help each other. And stay together, as they say, by staying apart. So that's it from me.
Oh, I love that. I'm going to use that as my new closing line. Stay together by staying apart. Sarana, thank you so very much for joining us. I hope you know that you will be a regular co-host on this program. I think you brought a very refreshing view and insight as to what is taking place. I am going to tag you in that article from The Guardian that I mentioned to you. I think you would find it very interesting. Again, thank you for joining us. Do enjoy the rest of the day. I know you're 5 hours ahead, so enjoy your afternoon and please stay safe. And what did you say? Stay together to stay apart. No, stay apart to stay together. All right, so we're going to go to a quick break right now. Quick break to come back, and Kenneth and I are going to continue the discussion on the COVID-19 response. We do have to touch on a couple of elements, such as this new plan here in Trinidad and Tobago to release some of the prisoners who would have been found guilty of minor non-violent offenses, as well as the cracks in our healthcare system that are beginning to show. Please stay with us. We will be back in just a minute.
Antel is Trinidad's most reliable and technically experienced ICT company, providers of quality structured cabling, Cat6 data fiber and power cables. We also stock cabling infrastructure basket-type cable trays for server rooms and data centers. Antel also installs and maintains video security systems including cameras, alarms and electronic entrance locks for businesses and residential properties. Call Antel 674-1406 or 783-9250.
And we are back, and you have here this morning Kenneth Luke, who is the head of our PEP Advisory Council, and myself as the PEP chairman. And we are discussing the ever-present COVID-19 pandemic, how it is impacting the world, how it is being experienced in different parts of the world, just bridging that gap that I know social distancing would have created for us, well, wherever you are and reside in the world. Kenneth, before we jump into those topics that I would have mentioned before the break, there's an issue, a topic that I would like to discuss. I know you mentioned that approximately 6.6 million people would have applied for benefits there in the United States of America. But can you tell me what and how is the public responding to these initiatives, and what exactly are these initiatives looking like? Here in Trinidad and Tobago, they're offering you $510 TT towards groceries, which is approximately 80 US dollars. You're also getting one $2,500 if you are you meet the criteria for not mortgage, rental assistance for up to 3 months. You're also getting the opportunity for unemployment,
Mhm.
if you've been made redundant, if you've been retrenched, of $1,500 a month, which I think is about a little over 200 US a month to survive one. Can you tell me? I mean, you may not have the exact figures, but what are some of the initiatives for relief and assistance for citizens who would have been laid off or going through a difficult time because of this COVID-19 pandemic?
Yeah, there are several types of relief packages offered. As I said, the 6.6 million people is just a large number that has the potential to overwhelm the systems. So it was pointed out that it happened in 1 week. With regard to unemployment insurance, that's normal because you contribute as an employer to as an employee to an insurance, unemployment insurance. And when you become unemployed, you have the right to go after support in that area. That support can continue in periods of 6 months. 6 months first time, and then you could get it reauthorized for another 6 months. I think they did something to give an extension. So that's people who had employment, were contributing their unemployment insurance contributions, and now are unemployed. So they are taken care of because I think they get up to 2/3 of their salary. Okay. For those who were outright retrenched because businesses had to shut down. Now, when the business shut down, some businesses have gone to things like this thing with the restaurants where they have curbside or you have drive-through. There's no inside sitting and dining in any restaurant that I have seen. With regard to the packages are broken up. I have actually the numbers. The stimulus gives 500 billion to stressed businesses to try to get them to support their staff or support the fact that they will not go under, to keep their mortgages and so on going. Now, a lot of people believe that that's money going to big business, but they have not made that very clear. 350 billion to entrepreneurs and small businesses. That's the intent. That's the intent in the bill. 250 billion to individuals and households. Now, how they do the 250 billion, it's going to be based initially on an initial check based on your tax filings for adjusted gross income. And that basically will give a single filer, somebody filing single, $1,200 in one check or one EFT. As I said before, those people who don't do EFT, electronic funds transfer, to their bank account, will have to wait longer to get the paper checks. With regard to filing single, I talked about that. Filing head of household, basically it's $2,400. Filing head of household and married and filing joint is $2,400 plus $500 for each child under 16. Now that is as far. Your audio, no audio. I'm not hearing you.
Sorry, I put my mic on mute to reduce any background noise. This is $2,500 per month, $2,400 per month US for.
No, what it is, the initial thing of $2 trillion dollars. This is what we know so far. That's a one-time check, one time.
Okay.
But there is discussion right now to extend that that piece of legislation so that they can do it repetitively. Now, there's a balance between how long this will last as against how much money government has to outlay. They are going to basically give these things as tax incentives so that people can write off this money. So the duration is dependent on how soon we go back to work. Now, based on duration, they're saying duration right now looks like this first phase is August, going to August. In my case, I have been allowed to work remotely up until the end of May. And after that, people have to go to the office, but we still will be to the August timeline at some risk. So a lot of people fall in these different categories, but the essential thing is that there has been assistance offered, and the checks go out April. Well, actually, not the checks. The EFTs begin on the 9th of this month. The whole thing about what I've seen in Trinidad for the elderly folks, especially lining up to go get their pensions and so on, the electronic funds transfer takes care of that and keeps the people distanced so that they cannot infect one another. So maybe it's a plus that they have in the pharmacy, for instance, and she talked about it before. They have spots marked on the ground where you must stand, so that you don't get too close to other people. But essentially, that's what the money looks like right now. And the safety net for the society is always temporary cash assistance and food and women's, infants, and children for milk and cheese and dairy products. That has been in place all along. That does not change. The burdening of the systems is where the issue becomes critical, because as we get deeper into this, there's more requests than sometimes is, and we've seen it in the healthcare practice, in the hospitals and so on. There's more demand than the resources allow.
Okay.
That's it.
Someone said, don't think that this money is free. We have to pay it back in our taxes next year. Is that how it works?
Well, for businesses, I know they're going to get tax incentives to offset the money because they're trying to encourage businesses to help their employees. We had one restaurant where one guy left a tip of $10,000. Another guy left a tip in another restaurant, and this is before the restaurant shut down seating. So for the individual, I do not believe that I am familiar. I don't think I'm familiar with how you're going to pay this money back, because as well as these, there are grants as well, which you do not have to pay back. So I am more than likely, the way things work here, you will have to replace that money by either a tax credit or by the government charging it off in the first instance, but you have to basically make the tax payment. So that's kind of how it is for the money. Okay. And as I say, the focus of that money is to make sure that people are kept whole, and at least temporarily, because that one-time thing ain't gonna last long. And the fact is, people are already crying. I see. So that's the issue. I think that's everywhere.
Well, that was my question. How is the public responding right now to these initiatives, some of which you mentioned will not come online as far as September? How and what is the general response from the population right now? Maybe you may not have that entire context where you live at the moment. I'm sure you're getting feedback from people who would be in contact with those who are more at risk, who are more vulnerable to the situation that has been unfolding in the past couple of weeks.
Yeah, well, what I could see personally is my work is in Medicaid, and we have seen spikes of 14 million transactions a month. Well, it trending that way because of COVID. And with regard to response, Medicaid takes care of medical expenses anyhow. Right now, you go into a hospital in emergency and you don't have an expense to pay. Under normal circumstances, if they put a transaction into the system, if the provider puts a transaction into the system, the Medicaid funds pay that transaction. So with regard to people responding, I think mostly because government plans are slowly coming up to to speed with regard to overcoming the deficiencies that were initially caused with slow movement and getting up to speed. I think what's going to happen is people are going to become more relieved. They're testing more, and the fear is basically dying down. But you see, the issue has become that people are now full frontal with their mortality. The fact that they could be so easily infected and possibly die based on their biology, that what is happening is people are becoming a little more compassionate. In normally what is a rushing society, that has calmed down, and what you have is the interconnectedness and the interdependency in the biology has shown that people need one another more. So the compassion is beginning to show. The people, like the people who are on the street, the homeless, they all have access to these things, to services, to soup kitchens. Well, they're doing a kind of delivery thing, just like the restaurants are doing. But, and I know today you all have a big a soup thing going on to address some. You're on mute. You're on mute.
I keep forgetting to unmute myself when I'm talking. Yes, the Pep Soup initiative that we are about to kick off starting this weekend, actually. But I mean, this is again private institutions who and non-governmental and non-profit organizations who are themselves trying to do their part in assisting with relieving the burden of this COVID-19 experience that we are all going through right now. What you mentioned just a while ago about the homeless, I mean, that for me has been a big concern because most of the times here, well, the homeless is basically taken care of by these nonprofit and NGO organizations. And with the shutdown that the COVID-19 has brought, I am personally very concerned about how the homeless themselves are surviving, seeing as we don't have businesses and NGOs functioning as they used to. I see them on the streets, and my first concern, is what are they eating? Normally, these are people who would go through bins. I mean, sorry, and it's sad to say it, but these are people who would go through bins to eat food to survive. We don't have people on the streets anymore. We don't have people buying food and throwing it away in the bins anymore. So what is going on with them? And the fact before COVID-19, we did not have a proper structure in place to deal with the most vulnerable and the street dwellers. Now that the pandemic has hit us, it is more concerning what is happening.
Yeah, well, this is an issue that is being covered by the social safety net here, because these people do have somewhere to go. There is an elevation even in the community for people to produce food to distribute freely. One thing that is happening here that shows what I talked about, the compassion and the interdependence very clearly. Nurses have become the new warriors in terms of response and commitment. They put their life on the line, and they do require that consideration. It's now coming from the society. Food is being delivered to the hospitals daily. These people are like champions on the forefront of a very, very mismanaged situation, which leads me to the next topic, which, well, not topic, but thought, which is that governments have their place. And we as human beings, and this is one of the things that PEP preaches, one nation under one flag, we have that interdependence. And in reality, depending on government to the degree, should bring us to the point where we are planting home gardens for self-sustainability. We even,
Indeed.
well, so these are the things that, to my mind, because I think like a humanitarian, that's always my focus, that societies need to learn and begin to develop, because food self-sufficiency is a I guess is a PEP mantra, and that basically talks about utilization from, and I mean, this goes back to the policies I talked about. The idea of putting agriculture in schools, and I'm not talking about that cup on the blotting paper and the red bean. I am talking about down in the trenches, dirty fingernails, children learning production, learning about harvesting, learning soil science from very early ages, marketing, harvesting, and developing a product. Both it's agronomy and its consumption patterns. So we talk this kind of stuff, but nobody does anything. We have people saying things like they have no land, which, hey, we know it have land. So at this point, all I'm saying is these are the lessons. And my feeling is that a government should be there for as we all do, should be there for the benefit of its citizens. But in terms of giving, I guess, giving rise to a working government, this is showing that all governments have that flaw, because it is really based on people getting into office, but they think they're getting into power. And then when they're called upon to respond, what you get is a lot of stuttering and very little in terms of a real tangible action that helps people. I'm come off my soapbox now.
No, but Kenneth, you're spot on. I mean, you mentioned something earlier about nurses being treated as the heroes of the day, and
Mhm.
they are. And I remember very early on in the very early on when the world was beginning to realize that this COVID-19 wasn't a farce, that it wasn't just going to blow over, it wasn't just a Chinese thing, and it was going to inevitably impact all of us. I remember seeing a meme that, and I don't have it word for word, but had it was a split screen, and on one side you had a football player. I don't know his name, well known football player. I don't know if it was Messi or, don't want to call the wrong name. And then on the other side you had a nurse in a nurse's uniform, and the meme basically pointed out the fact that we pay these football players and these athletes millions of dollars to basically kick balls and play a sport, whereas we have our medical professionals, the ones who are on the front line right now, the ones who risk their lives daily. I mean, right here, and I want to move into this topic about the Nurses Association and the nurses right here in Trinidad and Tobago.
Mhm.
And these are the ones putting themselves out there. They are on the front line. They get to work. They go to work every morning and come home to families. I'm sure in the back of their minds, they are concerned about the risk of passing on the virus to their families, yet still they're essential and they have to work. But when you look at the comparison to how we treat our athletes and our celebrities and our movie stars and our pop stars and rappers, as opposed to the people who are actually in charge of saving lives and preserving lives right now. And if anything comes out of this this crisis that we are experiencing as an entire planet, as the globe right now is going through. If anything that comes out of it, I hope that there's a re-evaluation of the way we treat the people who are responsible for providing essential services as saving lives, which is what they're doing. Nurses and doctors and janitors and sanitation workers, these are people putting themselves on the front line to keep all of us safe. Yet, when you compare the way they are remunerated for these efforts, when you compare the way they are treated, we have things upside down. We glorify those who bring us entertainment, and we treat those who are basically responsible for keeping us alive with yes, and I said should, and when we not should, but when we come out of this, because I'm speaking very positively, and I'm hoping that it's, and when we come out of this, I'm looking forward to seeing governments and administrations of the globe really take into account the way and the treatment of our medical,
Mhm.
janitorial, and frontline staff, particularly the ones who are putting their lives at risk every day to come out and keep us all safe. And with that, I do want to move into that topic about the Tobago nurses and doctors and the Nurses Association, the in fact that are concerned with what is transpiring in the healthcare profession. And like that article by Peter C. Baker revealed yesterday, in a crisis, in a community, sorry, during a crisis, you get to see the real
Mhm.
cracks in a community. A community is laid
Yes.
bare, and you see it for everything it is. You see those who have more, those who have less. You see all of the flaws in the system. And if anything, this COVID 19 is showing us here in Trinidad and Tobago, for those who were in denial, those who always knew it, it's really showing the cracks that we have right now in our healthcare system. We have a case actually of the nurses and doctors who were not wearing personal protection equipment,
Mhm.
PPE, who would have been in contact with the second COVID 19 patient who at the time was not showing any symptoms. He was asymptomatic, but then he went on to test positive for the case. And I mean, I know that healthcare systems are being pressured and tested across the globe, but here in Trinidad and Tobago in particular, it's really revealing how underprepared, how understaffed we were, and in stark contrast to what our health minister was saying back in January, back in February, which is that a COVID 19 virus is coming, but we are prepared for it. We're actually seeing quite the opposite here as we look at what is unfolding in the healthcare system. They are nurses, they're begging actually can to be tested. They want to be tested, and as of right now, you have to meet certain criteria in order to qualify to be tested. You would have had to travel or been in close contact. And these are nurses right now who are saying that they were in close contact, and they're begging to be tested because they themselves are being put at risk. They are also experiencing things. They want things like death benefits, and I don't get them wrong. A lot of these nurses, even on contract, we have them working. They're not on contract yet. They are on the front line. Should they um, come into contact or be impacted by this virus, and for I mean, sorry to say it like this, but it is a reality of the situation. Should they die from this, nurses, they should be entitled to health, not health, but death benefits. I mean, they have families just like us, and they are the ones putting themselves on the line to ensure our safety. So I'm looking and I'm reading this article, and I listened to the news last night where these nurses are basically lamenting their own conditions as they are working. They're lamenting the fact that some of them are being victimized by their landlords because these landlords don't want them renting from them anymore.
Right.
Knowing these are going into the hospitals and could possibly be bringing a virus back onto their compound. They are asking for protection and for the government to basically safeguard their own livelihood, the livelihood of their families should, like I mentioned earlier, should anything happen and go the way of them having father. What do you think about that, Ken?
Well, the first thing is, I think that because of the unpreparedness, it has shown some other things. It has basically the whole idea of pay for performance and pay for results is now becoming very, very clear, or just pay for being there. So there needs to be a refactoring of the entire medical profession. And it's worth to us as a society all over. I think that these people have more than shown their value when put in context of other professions like stockbroker who buys for one and sells for two. Because those people don't produce anything. These people produce life, basically, from birth all the way through to death. So they are in the forefront of human existence. And in terms of their appreciation, some people may be selfish in their current appreciation. And the persistence of that, we will see once it goes past, we get over this. But I am hoping that authorities and hospital, because a lot of these people are in business, the people who own these things are in business to make money. I mean, healthcare, there's more money in the maintenance of the disease than the cure. So all of these factors need to be reconsidered, and these people offered the right type of packages. And you mentioned death benefits. What happens here is by virtue of the insurance that is carried, they do get, terminal benefits. After retirement, if they retire, they take care of their own. But in crisis situations like this, there should be issues of hazard pay. There should be issues of remuneration. And the fact is, when these people go down, everybody else goes down. So what they have been doing is bringing back the retired nurses and retired medical practitioners, some of whom have come out of retirement, gone to the fight, and have died. So that's why I say it needs to be refactored, and the worth perspective and the value perspective of what certain things offer, they are not for free. People say, I get sick, I go to the emergency room, thinking that that's just the normal progression. If I compare to the hardships of how the structure in healthcare in Trinidad is, how it's done, and what's called the Patient Bill of Rights, is to me somewhat just of a political situation. To me, it is cover for inefficiency. These people are not given the due regard how they are dealt with by their superiors. The teams of doctors that operate under a consultant come down from that as a registrar, and then various teams. I've seen this firsthand in Mount Hope when the situation that my sister was in took her to an early grave. I've seen that the people are very good people, but they are muzzled, they are gag ordered, and they are threatened. So in this context, when you weigh that against their real worth, there's a very great imbalance. And a government coming into office, the next government coming into office, because this government has shown that it does not have the ability to fix some of these inefficiencies. And as politicians do, they hide a lot. So the next government coming into office needs to address these things in a way that are holistic. And all the touch points that the medical profession touches in the society have to be re-examined, reassessed, and the capacity planning done to make sure that all of this is taken care of. Forget borrowing money to pay salaries. We need to diversify the economy so we drive productivity in all sectors. Don't tell me about we don't have land. It's got 4,000 square feet, square miles of land. It could be backyard gardens. It could be agriculture commercially. And people eating healthy, more healthy will lead to nutrition and less dependence on a failing medical system, healthcare system. So that is my rant on that. But for the person themselves involved in this now, it now shows that the governments are not acting clearly on their behalf because political agendas are implicit. And we have a lot of death as a result. The result is clear. So
No,
my perspective is these guys and girls who go out there and put themselves on the line, people need to pay them a little more respect.
definitely. Definitely, definitely. And I mean, we have a situation here, Kenneth. Yesterday, I left my house for the first time since Monday, and I was driving to the supermarket and I was listening to a particular, because we have all of these public service announcements and all of these ads that are basically supposed to tell the public what to do and how to react during this pandemic. And this particular ad was saying that you don't need, if you don't have the virus, you don't need to be wearing masks and
Yes.
PPE. But that information seems to be a little bit confused because I remember Sarana was mentioning earlier that in the UK that they are wearing masks and they are going out, making sure they're protecting themselves if they are going out. The nurses themselves part of the Nurses Association, they were lamenting the fact that they were told that they don't need PPE for dealing with patients with confirmed cases. And I mean, there seems to be some miscommunication between and amongst the healthcare and between the healthcare services and the government based on the messages that were being given. Yesterday, I went out to the supermarket. Some people were wearing masks, some weren't. And I think maybe in the panic, there is a bit of misinformation and communication that definitely needs to be cleared up because if we really do not need masks and all of the things that people are using to safeguard themselves, and that could ease up a brunt of the burden of having to source and find masks for the people who actually need them. Whereas the people who actually need them, like the nurses and the doctors, they are the ones who are complaining that they don't have. So here in Trinidad and Tobago, I mean, like was not first world, second world, or third world to begin with. If you ask me, we are bordering between third and fourth world in our healthcare. And it's not to say that we don't, like you said, it's not to say that we don't have good people, not to say we don't have good doctors, not to say we don't have good nurses, but it's the people who are in charge of and managing systems that seem to have not understood the attention that they need to be placing on this, who seem to have forgotten that this is the business of saving and preserving lives. And in doing so, you can't politicize something. You can't, I mean, we have cases and we talk about it of corruption in the healthcare system. And if there was one place that I think should be free of corruption, should be the healthcare system, something like politicizing drugs and giving contracts to family and friends to provide medication and ordering gloves that costing 20 times the cost that it should usually cost. I mean, people are not understanding that when this happens, I mean, corruption at any level, any sector of public funds, any sector of government, any sector of public service is wrong at any level. But in particularly healthcare system, people need to understand that the opportunity cost of having corruption and corruption envelop this particular area is that we are literally losing lives. And I mean, that's something that when it comes to corruption and getting people to understand the cost of corruption, that I think I would continue to reiterate, because if it's one area, if it's one sector of our public sector that, should be functioning properly, it should be health. We are literally responsible, like I said, for keeping people alive. And like I said, everything, the areas that we would have failed in terms of managing properly the healthcare system, we're beginning to see it now as all of this unfolds.
Yeah. Well, it is that yeah, any corruption is bad, and but blatant corruption, because the effect of it shows up in different areas. It shows up where a guy sits in one country and says he's sending battleships into another area, so you get rid of drugs and drug laundering and money laundering. But back on our healthcare practitioners, those guys, people should be genuflecting to a large degree, because I was on a call yesterday, and one of the guys, his wife is a doctor, and these guys have now had to use their ingenuity for protection. And I think the same should be done when political influence fails, because people are really what's important. The reliance on themselves to a large degree is what's important. And this guy was talking about the wife coming home and stripping herself naked in the garage, put the clothes in a garbage bag, to be washed, shoes, everything. So it has gotten to the stage where they themselves do not trust the environment they're forced to work in and they're committed to. I mean, people get on these nurses and doctors get on the television, and you see tears come out of their eyes. And that tells you about their commitment. And to me, that commitment should be well rewarded. Money, benefits, support. The PPE issue showed a big hole in the argument that the authorities hold. The fact that, all right, this one was, I guess, extraordinary, right? But in reality, Satish brought up something to me this morning. The people who die from hunger are greater than the people who die from COVID so far. And the fact is, we don't really see that. That stuff is really invisible to a lot of us. So this is a total refactoring of humanity as far as I am concerned. From the guys who live on the street, who shouldn't have to, the psychological issues, this COVID-19 issue, the fact that these people have to operate and put themselves now at risk. They don't have the full complement of equipment. Telling a nurse that they should not use personal protective equipment when they are facing a patient who is infected just goes against human, I guess, values. And I understand that that is something that actually happened. So getting these guys what they need, not only in crisis, but normally, is where the responsibility lies. You hear all the different stories. There are all sorts of stories. Of course, all things are going to come out, some good, some bad, some totally untrue, some very true from certain perspectives. And for what I saw as what's happening in Tobago, and for what I saw about what these people are faced with, That should not be happening. When you have an army marches on its stomach. You got to feed the people well. You got to train them well. You have to support them well. I mean, your policies must dovetail with that the value construct. And if they don't, you're failing.
Definitely. And it's 9:30 and we just have about half an hour left of the program. We usually open the lines for you all to come talk your talk, call in, let us know what's going on in your part of the world, your part of the island. The number is 769-4590 if you would like to call in. We're actually going to move into another topic, which is the release of the prisoners. I had that earmarked to discuss today. I mean, there's so many points, so many concerns surrounding that. But you, the public, you are welcome to call in to touch base with us, ask Kenneth any questions, ask myself any questions. If you would like to leave any questions for me to ask Serrano, who will be joining us again next week, as well as some other guests from Germany, from Italy, where the epicenter of this virus has now shifted. We are going to be somebody from Istanbul is actually going to be calling in next week. I have some very exciting guests laid out for you as we get a general perspective of what is going on across and around the globe as we all respond to this COVID-19 experience. This morning, we touched a little bit about what is happening in the UK as it pertains to the lockdown. The measures are different here in Trinidad and Tobago. We still have restaurants open. In the UK, everything is on a complete shutdown. There in the United States, where Ken is residing, there's also a shutdown, but I believe people can go out and exercise. Is that true?
Yeah, people go out and exercise, but they're recommending that you try to exercise in your backyard. Or they're recommending you don't, if you go out to exercise, do your exercise, distance from socially distanced, and go back home. Because when you exercise, you exhale. And if you are asymptomatic, then you are putting that into this people's space, because they're saying now that they're aerosolizing the virus because it now could live longer and it persists longer in the atmosphere. So if you walk into an elevator where somebody just coughed and left, you're running into the virus. And that
basically, and I mean, that's the
that's what we
concern
always
right now,
thought
that
would
you can be
happen.
walking into it.
Well, we always thought that it would morph, but Fauci and these guys who are guiding the pandemic team in the current administration here are basically giving these cautions. You go out to exercise, go do your exercise, run around your yard, run around your house, but going into public parks where there are people passing you as they run or whatever, it's something that is recommended, that is kept to a minimum.
Definitely. So, like I said, the lines are open. 769-4590 if you would like to call in and talk with us this morning. Get anything you want to talk about, if you would like to comment on what we would have been touching on this morning. If you have any questions, last night on the live video that Philip did, we had people calling in and basically giving their own experience as it pertains to being out of work, being in a situation of not knowing where your next paycheck is coming from. You don't have to identify yourself. There's no shame, there's no embarrassment. Just call in and let us know how for you this experience, which is not unique to you but would be experienced differently by every individual who has to deal with this pandemic. Call in and give us an idea and tell us how it is affecting and impacting you. But while we wait to see if we get any calls, and I want to move in to that topic that got me very, very angry last night, which is the prisoners to be dropped. I mean,
Yeah.
listen, the Progressive Empowerment Party has been advocating for years now, we have been seeing that it is an absolute human rights atrocity that we have people languishing in our prison cells in remand yard while they wait for cases on minor offenses like parking in the wrong place, or breaking a traffic light, or not paying maintenance. And I mean, these are, yes, they are crimes in our law books, but they are considered petty crimes when considered or compared to murders and violent crimes like rape and homicide. And I'm listening to the AG last night speak about the of 140 odd prisoners in the effort to combat the COVID-19 spread. And so many questions, like I said, were raised in my head at that point, which is one, why did it take a COVID-19 pandemic to make you realize that people sitting in cells become even $10, waiting months and possibly years for a child to reach an acute, living more time in a prison cell than they would have served if they been convicted, is an absolute blatant disregard for the rights of human beings. I mean, why did it take this pandemic? And
Well, I think that there's a lot in political cover that is happening. Um, Putting these folks without having a plan. I don't know what the situation would be in the inside of the jail and how they could socially distance unless they are kept locked down. Um, but from what I understand, a lot of people are available, roaming the available space in the jails, and so they are coming into contact with one another. I don't know if a visitor could bring something to these people, but suddenly putting all these people back out on the street leads to thinking that, well, what is the possibility? Have they been tested? Are they going to test them before they release them? So I don't know what the plan is, but looking at the notes on this, I don't know where those people are going to go, where they're going to fit. They probably go back to a home somewhere. But what is their impact coming into that home? Are they now going to become infected if they weren't before? So all of these questions, I don't think that just a carte blanche write off of these folks and say, okay, back home for you. But there's a bigger question here. And it's something that we've been, as you said, we've been talking about for quite a while, which is, why are you having people sitting in a incarcerated posture, like what they call the remand yard? I guess it's a holding area, and feeding them and taking care of them, and the cost is hitting the taxpayer's pocket, whereas the cost of an expedited judicial hearing and determination would be a whole bunch less. Methods to do it rely on technology now, because the judge can sit in one room somewhere across the way, or even, as we say, build the room in the prison. But technology says that judge could be one way and the prisoner another way, and the trial held, guilty, not guilty, sentence, or release, because some of it, I believe, is trivial. Especially since they're now moving to make marijuana as a consumable. And some of these people were caught with marijuana for whatever, plus the victimization.
exactly.
We here are not, yeah, I don't have any information as to if they're releasing prisoners here, because I think they would have established certain protocols that they have for these things in an emergency like this. And those may be in place. What has actually happened is the normal releases are happening. Like, time for you to go home, you go home. But with regard to here it has always been a labor force. You heard about making license plates in jail, right? So what they have done is because we had these shortages and they were trying to ramp up fast the PPE, they have begun to give the prisoners, engage them in the issue by making masks and gowns and whatnot. So I think that this is something, that release that you're talking about and the cost of housing a prisoner, plus the decision made, I don't know if the appropriate set of planning has gone into it, or if it's just cover for if anybody is damaged, it's going to become harder to hide. I tend to be cautious about my suspicion, but that's what I think about prisoners and how they're being released.
Agreed. And there is the economic aspect where, as of right now, places are letting go people. Nobody is hiring anybody. There are even the menial jobs basically non-existent right now. What are we releasing these prisoners back into? You're releasing them into a society right now where employment, sorry, where jobs are scarce, where the economy is basically at a standstill, where there is little hope and opportunity because you're going to hear that I have a prison record. I'm already stigmatized against. Nobody wants to hire you. Are we just releasing criminals to become further or future criminals in society? Because again, what are they coming to, how expecting to integrate them back into society? They have much time apart from society, and we're bringing them back into a society right now that is basically not catered or set up now to facilitate such a number of people who would have, in essence, been falling through the system. What are we giving for them right now? And I mean, I'm sorry to say it like this, but I'm almost wondering if they would be better off in jail where they're at least getting some meals a day at the cost of $25,000 per prisoner per month. Then that raises this other issue. So when I made a post last night that spoke about this exact thing with prisoners being released back in society. And the person, somebody commented and reminded me that we spend upwards, or it's tabled on our expenses for housing prisoners in remand yard. We're spending upwards of $25,000 a month to house a prisoner who is yet awaiting trial. And I mean, compare that to the $5,000 bail that they cannot afford to pay, which is why they are being stuck in remand yard. And you can see and you can understand how this government does not seem to understand basic opportunity costs, because we have on one where we're spending enormous amount of money on housing and feeding and keeping prisoners, whereas we have the from the education ministry, we have those school transportation drivers complaining that they haven't been paid since January of this year. What are we really doing? And who are the people in charge of deciding how and where we spend money as a nation? And is it only to give kickbacks to friends and family? We have a call coming, and let me answer this call. Hello, good morning.
I just wanted to ask Mr. 340 if the U.S. government is not handling this thing, the proper way, what's going on with this dummies we are here? I see Philip was asking them not to have carnival since January. And these people, they're so far behind. They're months behind. They're in space. They don't know what's going on. They just don't know what's going on. It's shocking to know that a small party like the PEP is so far ahead of the government and even the media. And this guy is a great mind that I have there. I knew him from Trinidad. And he's way, when he was here, go backward, still swinging on trees, he was way ahead of us. He was making antennas and creep and making this and doing that. I think he needed to burst out the tree rather than where you were there. But I was helping running this country. That Mr. 340.
Yeah,
Very fun.
Yeah, he's hearing
that's from
you.
a different life. That is from a different
All
life.
right, yeah,
But yeah, it's
you
true. We are getting a feedback. We not really taking our value seriously because each of us born pure slate, and by our experiences and opportunities, we evolve. What has happened is that those are not facilitated by who you have elected to facilitate these opportunities for you. You hear all sorts of things. So when he refers to 340, this comes from a different life. Also Antenna Man and some other names that I don't want to say here. But effectively, it's about value. It's about understanding human value and reacting to it and facilitating opportunities that value can grow. Because, as I say, the child comes pure, but based on the track or the cutting track for monkey to run, which is what a lot of what's happening there. But I just want to touch back on the prisoner thing. One of the things that occurs to me is they're releasing people who were originally innocent and they may be turning them into criminals. So that is going to be a social impact that we don't know about. That's a tangential impact or a spin-off or a parallel impact that we don't know about. The offset with the dollars for maintenance of the $25,000, yes, that money could have been better spent all along. So you're talking about waste. You're talking about abuse of the public purse. And this apparently happens in many different ways and ways that are unseen. I mean, the FOIA requests reveal certain things that make your hair curl. But effectively, this guy who is talking there on the phone, I know him from back in Trinidad. We were associated in the ham radio CB 10 meter fraternity. And we did a lot of things for crisis management. I don't know if those practices continue, where they do 2 days of practice about emergency services and things like that. So he brings back that kind of thinking. And as I go back, it goes back to value. And we talk about the value of the prisoner. If we put it in context of the value of the human being that is a prisoner, that guy, while he was there, as the PEP puts it out, should have been trained to do something, not make deals over a cell phone that he shouldn't have in jail anyhow. So some of these things are what come up in my mind as you mention this thing. And in context of COVID-19, it now presents a separate impact that we don't know, cannot measure at this stage, because the planning is always retroactive. The planning is reverse engineered to suit the circumstance. And that is a fundamental issue that the country faces. I done. Soapbox over. Sorry. You're on mute again. Talk again. I can't hear you now. I turn up the volume here. I don't know what happened. I talk too long. I'll kill your mic. Sadish. I heard something. It's gone. I am not hearing you, Felicia. Nothing.
Public health in Trinidad and Tobago is a catastrophe. It is a fiasco. It is the sixth and seventh circles of hell. Some people say public health in Trinidad is sickening. The Prime Minister agrees. Judging by his latest decision, 4.5 years later, as Prime Minister, the man who spent upwards of $25 billion on public health in this country has chosen once again to seek his own health care in other jurisdictions. Public health in Trinidad and Tobago has never worked to the benefit of the public under no government at no time. We, the people of Trinidad and Tobago, are spending money we do not have, building hospitals we do not need, in a public health system that does not work. The Progressive Empowerment Party suggests that in place of the fiasco that exists as our public health system, that we replace it all with 41 public health centers, one for each constituency, operated 24/7, managed by nurse practitioners with on-call doctors capable of treating dental, optical, and medical emergencies, to function as 41 emergency rooms in this country, equipped even for minor stabilization surgeries and with dedicated ambulance service. This would function far better than the chaos of the centralized public health system that does not work. How it should work, how it works in foreign jurisdictions. A call to a call center should be answered by a trained operator who knows how to ask proper questions so as to guide paramedics listening in on the line as to what your condition might be, so that they can prepare to treat with you when they arrive. The call to that call center that identifies your location plugs in GPS coordinates that guides the ambulance directly to you, so they don't have to call asking for further directions, looking for landmarks. A call to a call center that guides the ambulance to your house in under 10 minutes, the magic time that science suggests required to save patients in emergencies such as heart attack, stroke, and other massive failure. The paramedic operated ambulance is stocked and equipped with everything to treat with just about every emergency. But in specialized cases, there are special kits that they could add in quick time. And that is why the questions that a trained operator asking would advise them and guide them, so that when they come to you, your treatment begins during transportation. The paramedics then take full responsibility for you and initiate conversation with the closest emergency room where they're taking you. The doctor on call or the person in charge would then exchange information with the paramedics so as to further guide the treatment that is being done while you're being transported to the emergency room, and the emergency room would be preparing to receive you. Arriving at the hospital, the paramedics are greeted by the emergency room team, who takes full control of you, guides you into the treatment room, puts you onto a bed, releases the stretcher, and releases the paramedics and the ambulance. In a first world country, at that point, the emergency room staff are responsible for you, and they treat and discharge you or they treat and admit you to hospital for further treatment. If at any point along the way the worst should occur and you expire, there are morbidity and mortality conferences that you can request beyond an autopsy if suspicion exists that someone along the way was remiss in their responsibility or negligent. And everyone in that chain, from the operator at the call center to the ambulance driver, the paramedic, the emergency room team, and any doctors and nurses treating with you after, are aware that there are serious consequences for malpractice, including charges of depraved indifference to human life. This is the level of public health we are entitled to in this country. We spend $5 billion a year for our public health and get this fiasco in exchange. Isn't it time we did better? The Progressive Empowerment Party says so, and says that there are people in the world that we could hire and empower and employ to provide proper, adequate, professional, first world public health in Trinidad and Tobago, as described before. We can have a better country. We can have proper health care. It's a matter of voting. It's a matter of choice. What we do next is important. I am Philip Edward Alexander, and this has been a little more than 3 minutes to a better Trinidad and Tobago. Good day, Trinidad and Tobago. Once again, the issue of our porous borders are not making the amount of news that they should, despite the fact that they are causing a lot of the problems that are plaguing this nation. The Commissioner of Police had to belabor the fact again that many of the victims of human trafficking being used to run the prostitution rings in this country now are themselves being trafficked into this country or entering Trinidad illegally on any of our unmanned coastlines. It has been this way for all of our independent history, and the advent of the drug trade in its infancy in the early 80s prompted the then government to commission what we now know as the Scott Drug Report, that resulted in findings so damning to high members of society that we were unable to lay it in the Parliament. Out of fear, I believe.
Guys, we are back. We had a little technical difficulty there with the audio a while ago. We had to cut to some ads while I'm just under 2 minutes left of this program. Kenneth, the call that we had just now, he was asking if you can tell or if you have any information on the time frame, or what is the projected time frame that all of this is supposed to end, at least any information coming out of on this in the United States at the moment.
They believe that there will be a downward trend starting in August. And that is based on the current rate of infection and things that are being put in place. Now, they also believe, and Fauci was on the TV last night talking about a second wave. And questions were being asked as to whether the cured can reinfect other people. They also showed a gentleman who is doing there are 45 people in a test that is tested a new method for curing this, that he says so far for a week in, he has been having no problems, no tightness, no fever, no headaches, and so on. And they are going to keep testing to see if that resolves itself. I personally believe it will get to a stage where sometime in December, everybody would have either gone through, been inoculated, when traditional medicines and vaccines are made available. So I don't think this going to go away anytime soon, especially if there's a risk of reinfection. So there's personal responsibility. There's people caring about people to keep themselves safe. And until then, I don't think things will get back to normal. And we may have to think about working remotely from home. We may have to think about changing the way we buy groceries, go out, exercise, all those things. And do it in a way not to infringe on personal freedoms. So that's just my opinion based on what I'm seeing coming out of these experts. In the
Okay.
meantime, sorry, go ahead.
No, you go ahead.
All I was saying is, in the meantime, what I am seeing on my job is a serious uptick in Medicaid claims. And that uptick says that people are either fearful, have real issues, and at the same time, we are seeing it hasn't leveled out. I think it is trending downwards. Normal other sicknesses. People are, I guess, abstaining from going to the hospital. They have suspended elective surgeries. So the focus is really COVID.
And we are out of time. Unfortunately, the technical difficulty lost us about 5 minutes that we had in the program. But I think on a whole, it was a very thought-provoking and informative program. Kenneth, I would really love to thank you for joining me this morning. Sarana, wherever you are at work and listening to this program, thank you so much for being a part of it this morning. Getting all the different perspectives from across the globe has been important as we all go through this as an entire planet right now, dealing with I would say unexpected virus, because many of us started 2020 not knowing what lay ahead, and here we are now in April, the third day of April, and for many of us, life is not the same and may never be the same following the outcome of this pandemic. Experts are saying that it may go on as long as a year, some are saying a few months. Exactly how drastic the impact will be, exactly how long this goes on for, would depend on our ability as an entire planet, as a society, to flatten the curve and to manage and control this virus. Kenneth, like I said, thank you for joining me so much. To all of my viewers this morning, for everybody who would have tuned in, our caller who called with his question, please stay safe. According to Sarana, to stay together, we need to stay apart. And join me again on Monday, where we dive into another issue of Pep Talks in the Morning with a brand new host and a brand new guest. Stay safe and Tobago.